Good morning. My name is Paul Smith, and I represent the National Association of Health Underwriters. I am also a independent broker, a health insurance broker in the state of Connecticut, representing small business people, small business person myself. Our organization, along with the Chamber of Commerce's, have been out educating people about the healthcare reform bill, about what is in it for them, or what is not in it for them. And like others up here, we're in favor of healthcare reform. We want to see healthcare reform happen. It's a necessary thing to move forward. And myself and a group of us from Connecticut have been to Washington, D.C. Up to 4 times this past year, talking to Congress, talking to our legislators about what it is that we need to reform. And the things we need to reform, unfortunately, is not in our bill today. And hopefully with what's happened lately in Massachusetts, it'll back up a few things and people start to think about what are the things we really need to reform. And the things we need to reform are things associated with cost, which are not in our bill. And one of the big things that drive our cost today in our private insurance is the fact that the government does not pay its adequate fair share on Medicare, or does it pay its fair share on Medicaid, which those costs are shifted back to us in the higher cost of premiums. The other issue is that the government is not doing anything about, and it's been mentioned already, is malpractice. The government is not doing anything about malpractice reform, which again forces doctors to practice medicine defensively, orders tests that are maybe not necessary, but continue to cost their malpractice insurance money, which then gets pushed off to the consumer and pushed off to insurance. So we are for healthcare reform. We are going back to Washington D.C. in 5 weeks to again sit down with Congress and talk about our issues. Personally, I was born and raised in Massachusetts. I lived in Connecticut for the past 28 years, but in talking to my family back in Massachusetts, who are Democrats by far for their whole life, said to me that the reason why they voted for Scott Brown was they started to learn about the bill, and I think that's what's happening today in our nation. That people like the organization that's here today and my organization, we're out educating people about what's happening with our healthcare and what is this reform all about. People are learning, and people are learning that this is not the right type of healthcare, and people want it done right. So I'm happy that we're going to get this opportunity to do it right. Thank you very much.